everybody. In today's session, we'll be seeing how does smoking and alcohol impact the fertility health. So we know that smoking causes multitude of problems, such as affecting the cardiac system, affecting the heart. It can affect our lungs. One can develop an increased chance of developing cancers. It could be a lung cancer, stomach cancer, or a bladder cancer. Along with that, it does have a significant impact on the fertility or the reproductive health of both men and women. So it has the major the effect that is caused because of the smoking is mainly because of the presence of nicotine, various tar products, which are both carcinogens. They have the potential to cause malignancies or cancers. Along with that, it affects the egg quality and the sperm quality in both men and women. So and most of the effects of smoking is mainly because it's a dose dependent action, meaning the severity is worse when more number of cigarettes are being used. So as and when a man increases his smoking, the number or more and more cigarettes are being used, or it could be in any form. It could be in the form of smoking, it could be in the form of tobacco chewing. So any form of tobacco has an impact. So when these chemicals enter the body, so they are known to cause various hormonal changes, and especially in case of chronic smokers, it causes increase in estrogen levels within the body and reduce the male hormone levels, which significantly reduces the volume of the testes. It can result in abnormal sperm production, reduces the count of the sperms, reduces the motility of the sperm, that is the forward moving capacity. It reduces the normal structure, the percentage of sperms which have all the structures being normal also reduces, and also it increases the DNA fragmentation index. So most of the sperm, once the DNA fragmentation index increases, then the chance of conception naturally drops down. It increases the chance of miscarriage, doubles the chance of miscarriage, and all these effects are higher and higher as more and more cigarettes are used for more duration of time. And the studies have shown if one uses about 10 to 20 cigarettes per day, there is 20% chance of it affecting the semen parameters and infertility. And also it increases the chance of infertility 2.5% every year as the age advances. So one should not consume, the smoking should be reduced, and it is not only about active smoking, and of course passive smoking also has a significant impact on the sperm production. So one needs to be very careful, and it has to be cut down as early as possible. Whereas in case of females also it has got similar effects. During pregnancy, it should be completely avoided, because this nicotine, when it crosses placenta, it can affect the growth of the baby, affects the blood supply to the baby. So it has to be carefully, it should be completely avoided. And during the reproductive age group, if a woman smokes about 5 to 10 cigarettes per day, then definitely it has a very significant impact on her ovarian reserve, the egg quality that is released, her chances of conception. So because of excessive smoking, what happens to women naturally at the age of 40 or 30, between 35 to 40, happens within 35 years, or within 30 years is common. So it reduces the egg reserve, increases the FSH levels within the body, reduces the estradiol levels, reduces the egg reserve. All these things put together will significantly bring down the chances of pregnancy. Also, because of smoking, both in men and women, if smoking increases, the risk of miscarriages is almost doubled or 3 times. So one should stop smoking, especially when they are planning for pregnancy. Now coming to alcohol, we have that some do feel that alcohol is not dangerous, and it is a social drink and it can be consumed. I would say it's partially correct or partially wrong. Alcohol can be, it is again dose dependent. For men who consume more than 180 ml per day or for about 5 days a week, is considered as chronic alcohol, and they do notice a lot of hormonal changes within the body, because of which they might develop erectile dysfunction, reduced seminal volume, they can have the reduced sperm count, there could be motility of the sperm which is affected. So all these things will affect their pregnancy chances. Similarly, in case of women, having about 5 to 10 drinks a week could be very dangerous in her reproductive age group. So this can impact her ovarian reserve, egg quality, and also it increases reduces the chance of conception significantly by about 2 to 3 times. So one should avoid using drugs like using substances like alcohol and smoking, especially during the reproductive age group. Thank you.